Now, let's transition into the first topic of this week's discussion, all about leisure activity. Recreational leisure activities enrich our lives in so many ways. Leisure activities are often chosen for pleasure, relaxation, or other emotional satisfaction, typically after work or other responsibilities are done. Often, leisure activities reflect personal interests that support current interests, perhaps from one's childhood or early adulthood. Please take a few moments to think of all your favorite activities and how they make life better. Recall positive experiences and memories that were created as a result. Now consider what life would be like without them. This is an excellent way to reflect on one's life's pleasures as we participate in meaningful activities throughout the day. Throughout your consideration of these activities you love, consider making personal goals for bringing more of these activities back into your daily life and providing yourself with this self-care time to engage in joyful pastimes. Leisure participation and social participation often go hand in hand, and studies in human biology support the significant role that social connectedness and human interaction play in supporting one's wellness. Individuals may discover even more enjoyment in leisure activities when they are able to share these experiences with others whom share similar interests. This stimulates deeper connection and promotes lifelong learning through the exposure to others' perspectives. Leisure activity can occur anywhere from your immediate environment to out in the community, ranging from sitting outside for the sunrise to watching your favorite television show series. Now that we have discussed the importance of leisure for occupational health, let's consider another area of occupation that supports safe engagement in meaningful leisure and social participation activities. That's right, we are talking about rest and sleep. First, I will discuss sleep hygiene and sleep health. As we age, we all experience normal changes in our sleeping patterns, such as becoming sleepy earlier, waking up earlier, or experiencing less deep sleep. However, sleep is just as important for your physical and emotional wellness as it was when you were younger. A good night's sleep helps improve concentration and memory formation, reduce daytime sleepiness, improves our ability to interact with our environment, minimizes the risk of nighttime falls, and supports participation in meaningful activities. I would like you to take a moment to rate your sleep quality on a typical night. Do you find it easy to fall asleep and stay asleep? Do you wake up feeling alert and ready to take on the day? Do you experience fatigue or drowsiness throughout the day? Are there concerns that you have related to your sleep routine? I'm going to cover some common sleep concerns and offer tips that are intended to help you identify sleep-related problems. I hope these tips help provide you with a guide for getting a good night's sleep and improving the quality of your waking life. Research highlights poor sleep as a significant factor for falling. Studies have found that reduced sleep quality is associated with a higher risk of falling due to difficulty concentrating, decreased reaction time, impaired attention, and daytime drowsiness. In order to promote participation in meaningful activities and support a safe engagement, sleep health is an essential consideration. First, let's discuss sleep duration. Does anyone know how many hours of sleep is recommended for older adults? While sleeping requirements vary from person to person, most healthy adults require 7.5 to 9 hours of sleep per night. However, how you feel in the morning upon waking is the best indicator of overall sleep quality. Frequently waking up not feeling well rested or experiencing daytime sleepiness are indications that you may not be getting enough sleep. One of the most common reasons of sleep disturbance is insomnia. Insomnia is a condition that makes it difficult to fall asleep or stay asleep. Those experiencing insomnia may feel dissatisfied with their sleep, and common symptoms include fatigue, low energy, difficulty concentrating, and mood disturbances. People may describe themselves as light sleepers. Other common sleep changes may include getting tired earlier in the evening, waking up early in the morning, waking up in the middle of the night and not being able to go back to sleep. It is important to stay in tune with your sleep health and changes you are experiencing, as sleep patterns may change as a result of age, lifestyle, pre-existing health conditions, and your bedroom sleep environment. The great thing is, identifying the root causes of poor sleep helps guide lifestyle adjustments that can help improve your sleep quality. First, let's try identifying some underlying factors that may be impacting your sleep quality. Ask yourself, are you under a lot of stress? If yes, what causes you the most stress? Do you experience low mood? Do you experience anxiety or worry on a regular basis? Is it difficult for you to wake up in the morning? Do you wake up feeling groggy? Do you experience daytime sleepiness? Do you nap regularly? Do you drink caffeine? If so, how much, and how late into the day? Are you taking any medications that might be affecting sleep? Do you experience daytime and nighttime pain? Has your physician diagnosed you with a health condition or a sleep condition that may be impacting your sleep? Do you feel safe and secure in your sleeping environment? Often, we can make improvements in sleep health by creating a consistent night routine, forming healthy daily habits that support sleep health, addressing emotional concerns, and improving our sleep environment. To support the body's natural sleep-wake cycle, it is important that we prioritize the period of sleep preparation in order to get ourselves into a restful state that supports deep sleep and relaxation. First, I encourage you to maintain a consistent sleep schedule. A complete sleep routine includes going to bed and waking up at the same time every day, even on the weekends. This should support your lifestyle so you are able to stick to it on a consistent basis. If you are feeling rushed at the end of the day, consider beginning your bedtime routine 30 minutes earlier. You may want to personalize your routine by beginning the process when you are usually beginning to tire, even if that's earlier than it used to be. This way, you are supporting your body's natural signals for the need of sleep, and often this supports a more wakeful morning as a result. Another great addition to a bedtime routine is the development of soothing bedtime rituals. I encourage you to explore activities that make you feel the most relaxed. Some examples include a warm shower or bath, playing music, practicing relaxation techniques like stretching, yoga, mindfulness meditation, and deep breathing, as discussed during week 3. Everyone is unique in what works best for them, so this week, consider trying out a few different relaxation practices and get a sense for what feels best and what is most realistic for you. Here are some popular meditation apps and sleep sound apps that may be a great addition to your bedtime routine. Another important component of sleep health involves daily routines and habits. Supporting good sleep goes beyond just nighttime practices and can be further supported all throughout the day. Some daily habits to support sleep health include limiting caffeine intake, especially after lunchtime. The stimulant effect of caffeine remains in your system for hours following consumption, and this can trick your sleep hormones into thinking it is daytime rather than nighttime, making it difficult to fall asleep at your desired time. Avoiding alcohol before bed. Alcohol works on the body as a depressant, and it can initially cause feelings of relaxation and drowsiness. Although it may feel as though it helps you fall asleep, it impedes on the normal sleep rhythms throughout the night and reduces the quality of your sleep, making you less alert and wakeful the following morning. It is important to satisfy your hunger prior to bed so you are not waking up needing fuel during the night. Consider a light snack that is easy on your digestive system and low in sugar, perhaps a handful of nuts. Try to minimize the consumption of sugary foods. Sugar consumption spikes your body's blood sugar levels, and this may cause feelings of overstimulation, making it difficult to transition into a restful state before bed. I encourage you to minimize liquid intake before bed because this will reduce the need to use the bathroom during sleep hours. Nighttime urination requires navigating one's sleeping environment in a darkened room, and this can increase the risk of falls during the night. As previously stated, aerobic physical activity, strength training, and balance exercise of choice is highly encouraged for health maintenance. Physical activity plays a key role in supporting sleep health. Research supports the correlation between regular physical activity and improved sleep quality. Moreover, physical activity is great for supporting bone health and lean muscle mass, all important in daytime mobility and balance. Some great options include swimming and water exercises, dancing, walking, golfing, and completing chores around the home. I encourage you to explore various options to help discover what brings you the most joy. Many older adults schedule a routine nap during their day. If you don't feel fully alert during the day, a nap may provide the energy you need to perform fully and reduce the risk of falls. Consider some of the following tips to optimize your nap periods and feel refreshed rather than groggy. You may want to experiment on days when you have ample time to see if these adjustments help you. First, keep naps short. A nap as short as 5 minutes can improve alertness and memory processes. Most individuals benefit from limiting naps from 15 to 45 minutes, as you may feel groggy after a longer nap. Naps should be taken earlier in the day rather than later to minimize difficulty falling asleep. Perhaps a nap can be included after lunchtime to support alert participation in afternoon activities. Lastly, I encourage you to take a nap in a comfortable environment with limited exposure to light and noise, and make sure you are in comfy clothes to support a restful period of relaxation. To address emotional concerns that may be impacting your sleep quality, here are some tips for reducing mental stress. Journaling is a great way to combat daily stressors. Perhaps you can keep a journal right next to your bed on a side table. This is a great way to clear your mind before bed so you're able to coast into sleep without your mind going all different directions. Creating a to-do list is helpful for daily organization. This may include checking off tasks completed and listing out goals for the following day. There are some ways to set yourself up for success by maintaining a consistent morning routine. A morning routine is just as important as a night routine. Feeling rushed for time can increase the risk of falls. By taking time to plan out what you need for the following morning, this can help you wake up alert but not stressed and guide you into a peaceful start for the day. Lastly, consider engaging with supportive friends and express what is troubling you. This human connection can be powerful in helping you ease your mind and offers you an outlet for advice about your concerns. By clearing one's mind, you are setting yourself up for a better night's sleep with less interruptions. It can be frustrating when waking up in the middle of the night and having a hard time getting back to sleep. Consider some of the following tips for easing yourself back into a restful state. First, please try not to stress. Do the best that you can at staying out of your head by focusing on the feelings and sensations in your body instead. Participating in a non-stimulating activity like nasal breathing can be helpful in easing you back into a restful state. If you are awake for more than 20 minutes, consider reading a book that you can keep within arm's reach. I suggest keeping the lights dim and avoiding screens as the blue light exposure can stimulate the body, making you feel more awake than before. The importance of one's bedroom sleep environment shouldn't be underestimated. A conducive bedroom environment can support a quick transition into a restful state. On the other hand, bedroom factors that impede on sleep hygiene can keep you tossing and turning. Consider the following ways to optimize your bedroom for sleep and reduce the risk of falls during sleep preparation. First, let's discuss noise. In general, it is best to sleep in a quiet place. As humans, we tend to respond to external stimuli while asleep. In other words, if we hear a noise, our body is trained to wake up. Even if we don't become fully awake at the sound, noises throughout the night can limit the amount of deep sleep we get, making us less rested during the day. Some ways to support a quiet environment include using a fan for white noise and putting in noise cancellation earplugs. Next, the temperature of the bedroom is very important for sleep quality. Most people prefer to sleep in a slightly cooler environment, although everyone is different in what is best for them. If you notice you are often waking up shivering or sweating, the temperature of your sleep environment may be a problem. Our bodies dip to our lowest temperature levels about 2 hours after going to sleep, and this helps us preserve energy, supporting better sleep quality. You can always add an extra layer of clothing or socks during sleep preparation if you feel a bit chilly. As for lighting, the amount of light in your bedroom can impact how well you sleep. Sleeping in darkness is the best, and utilizing a nightlight can be a great safety support to reduce the risk of falls, especially if you commonly wake up at night to urinate. I recommend placing a nightlight near your bed and a nightlight near your bathroom, creating a clear path for navigation during the night. Also, consider supporting your natural dark light cycles. This means sleeping when it is dark outside and waking when it is light. Other considerations include making sure your pillow and mattress are comfortable. If you experience pain, placing a pillow under the painful area of the body may help support the body's alignment and reduce nighttime pain. Also, wear comfy and breathable clothing to bed whenever possible. Breathwork utilizes breathing exercises to improve all areas of wellness, serving as a simple and powerful technique for connecting the mind and body for self-regulation. Also, breathwork increases blood circulation throughout the body, which can help decrease anxiety, improve sleep, and increase energy levels. 4-7-8 breathing is a great exercise used as a natural tranquilizer for the nervous system, gaining power with repetition and practice. Use it whenever you are aware of internal tension and before bed. 1. Allow your lips to gently part. 2. Exhale completely. 3. Close your mouth and inhale quietly through your nose to a mental count of 4. 4. Hold your breath for a count of 7. 5. Exhale completely through your mouth, making a whoosh sound to the count of 8. This is 1 breath. Now inhale again and repeat the cycle 3 more times for a total of 4 breaths. Next, Gertie will demonstrate progressive muscle relaxation, a deep relaxation technique used to control stress and anxiety, relieve insomnia, and reduce symptoms of chronic pain. PMR is based upon simple practice of tensing or tightening one muscle group at a time, followed by a relaxation phase with the release of tension. 1. While inhaling, contract one muscle group, for example your upper thighs, for 5 to 10 seconds. Then exhale and suddenly release the tension in that muscle group. 2. Give yourself 10 to 20 seconds to relax, and then move on to the next muscle group, for example, your calves. 3. While releasing the tension, try to focus on the changes you feel when the muscle group is relaxed. Imagery may be helpful in conjunction with the release of tension, such as imagining that stressful feelings are flowing out of your body as you relax each muscle group. 4. Gradually work your way up the body, contracting and relaxing muscle groups. PMR at night helps those suffering from insomnia fall asleep. Also, it is an excellent tool to help learn about the body and signals it is telling you. With practice and time, you can learn to accurately identify and diminish signs and signals of stress and tension. Here, Gertie will be demonstrating appropriate side-lying and back-lying positions while lying in bed, using pillows for support as needed. This helps add comfort and eliminates pressure and muscle tension. It also reduces lower back pain and muscle cramps. When sleeping with a pillow or two between your legs or knees, this can help alleviate the pressure on your lower back and your hips. In turn, the alleviation can help reduce swelling in your lower back, allowing you to receive a good night's sleep. Lastly, it provides a straight side-lying position, placing your back into a neutral position where it's neither flat nor arched.
Thank you for spending time with us in the Aspire Fall Prevention Program. We hope you learned some working strategies and perhaps you're already feeling stronger and more confident. Keep them up. The strategies and exercises are meant to be done as part of your daily routine. You should also talk to your doctor about any falls you've had or your fear of falling. And if you feel that you need more than this program was able to offer, ask your doctor for a referral to a therapist. Remember, falls are not a part of aging and they are preventable.